Chums is here. We are going to demonstrate putting a muzzle on with him. So one of the things you really want to make sure you do is make sure that your strap is long enough to go behind the head so that you're not, down here where it's real short and you're trying to adjust. You just want to take the muzzle, and generally it's easier to come from behind versus going straight at them, so that you're not just charging at them with this weird thing. So just come on behind, put that right over the snout, come up under the ears. Secure the clasp, and then ideally tighten the muzzle. There we go, just tighten that strap. So we are demonstrating the use of the restraint pole, also known as a catch pole, used for aggressive dogs today. So I've got the pole here, and Chumley is my subject, so I will be catching him with that. You can see we have a long pole here that we can do, and so I can use it to catch him from far away to prevent any bites to my person. So just come up to the dog. It's already open. Slip it around his head, and then pull here on the wire to tighten it around his neck. Come on, Chums. There we go. He'll walk with me a little bit. And then to release it, Chums is going to walk behind me. To release it, just pull up on this back part here and slip it back off. And we've caught and released with the catch pole. So we have Adeline here, and we are going to wrap her in a towel. You can see she's a little bit squirmy. So if we needed to draw blood, or if she was real fractious with anything, we would wrap her in a towel to help with our restraint. We also call this a kitty burrito wrap, because we pretty much wrap it like a burrito. So I'll wrap her over first. I'll wrap this back part around as well, so it's harder for her to back up. And then wrap the long part around and lift and tuck under, so it's a little bit harder for her to squeeze out of the towel. And then, for example, if we were doing a jugular stick, I would just be able to hold her right here. She's all wrapped up in the towel, so she can't move much while we're trying to do that. We're going to do a quick urinary catheterization on Faden here today. So I've got my gloves here to help protect myself and Faden. We're going to get a little bit of a scrub here on this prepuce to kind of clean the area up. And then you always want to measure the catheter. This one's a little bit skinny, but you kind of want to measure the catheter to see where it's going to enter the bladder. So we're going to end up going pretty far in for him because he's a little bit bigger dog. And I'm going to put some lube on this catheter as well to make things a little bit more comfortable for him. So kind of grab the shaft of the penis and push cranial, and that will generally express the actual penis itself. Just advance that slowly. Up the urethra into the bladder. Not getting any dripping coming out, so I'm going to go ahead and grab my syringe and confirm placement with that. And there we go. We have some urine, so we are in the urinary bladder. And get some urine from Miss Ivy Dog here. She's usually pretty good about stopping the squat to pee. Come on, let's go out onto the grass. Just woke her up from a nap though, so she's a little bit snoozy, sleepy. There we go. In order to catch that free urine sample, just put that ladle underneath there while they are squatting. And I'm going to hold the leash with my foot so I can draw up the urine into my syringe. 3 mils for most urinalysis, plenty of what we need. Just toss the rest, and we're good. I'm going to do a quick ultrasound assisted cystocentesis on Ivy. I'm going to go ahead and just do a little bit. Ooh, that's cold, huh? She's a good girl. I'll do just a little bit of scrub there. Kind of help lessen any bacteria that might be in the area. And a little bit of alcohol as well to help with the conduction of the ultrasound. Not a terribly big bladder. And I'm just going to insert the needle directly down next to my probe. And pull out that urine. There we go. Express anal glands here. So always want some gloves. And we've got some baby wipes here. I'm just gonna got some lube there on my finger. Insert that into the rectum. Anal glands are usually around about the 8 o'clock and the 4 o'clock mark. And just gently squeeze. And there we go. Nice gross anal gland material. Okay, Porter is here for nail trim and anal gland expression. So we're going to start with his nails. Hold this leg up. Trim a little bit at a time up to where the quick is. You want to get the quick just as close as you can. And I generally try to round the nails off a little bit so they're not quite so sharp once we trim them. And we've got our quick stop here ready to go in case I do trim a little bit too far and hit the quick. We can use that to make sure that the nail is not bleeding. So now that Adeline is all wrapped up in her little kitty burrito, we're going to go ahead and trim her nails. So we've got her head, I'll push it out of the way a little bit and wrap my arm a little bit underneath the head to kind of help stabilize that, and pull her foot out from the towel. And each toe, you just press down on the toe and trim that hook off there. Get the very pointy, sharp, ouchy nails when they decide to try to mush on you. And there's a dew cloth here somewhere that I'm going to get. And there we go. That is nail trimming on a cat. We have Ivy here today, and we are going to give her a Capstar. It is a pill that kills fleas. She does not have any, but we're just going to use this for demonstration purposes. It is non-toxic. So just grab the top of the snout, squeeze on the sides to open up the mouth, pull that down, jaw down, push that as far back as you can, and then rub her throat to make her swallow. And we have Pill the dog. We're going to demonstrate pilling a cat with Snape here. We're going to try using the pill popper. I'm not always very good at that, but it's a little bit easier a lot of times with cats versus getting your hands squished. So we'll just squeeze the mouth open, put the pill popper in as far as we can, squish the plunger down, and then you want to hold the mouth closed and rub the throat to help encourage him to swallow. Which is not working, so I tried blowing on his nose, which also is not working. But he did swallow. and he's not spitting it back out. So that's pulling a cat. So we have Ivy here, and we are going to clean her ears today. And so we've got just our general ear cleaning solution. I'm going to pull this pinna up here, squeeze just a little bit in that ear, and swish it around real good. And then roll the cotton a little bit so it's thinner and easier to get out of the ear. It makes it a little bit longer so you can pull on it. Oh, just rub that around, get all that ear cleaning solution on the cotton. Ew, and her ears are pretty dirty, actually. So we'll do one more little swab there. And then we have our Malodic medication here. And this is one that is traditionally used for ears and can be used for ear infections. And just uncap that. Again, pull up the pinna, put the applicator in. Again, not all the way down in the ear, just enough to get it so that it's going where it needs to. Just kind of fill the ear up until you can see it, and then squish that around so that it covers all the appropriate parts of the inner part of the ear. So we have a clean and medicated ear for Ivy. We are going to demonstrate ear cleaning on Snape today. So I'm going to roll up my cotton ball a little bit, put some solution on it, hold that pinna straight up, just kind of set that cotton ball right in the ear. Oh, that itches. And then just squish around real good at the base of the ear. Go ahead and wipe the pinna as well. And we'll just do one more swab just to make sure that we've gotten all of our cleaner out, make sure the ears are nice and dry for our medication. There we go. We've got some Malodic we're going to put in these ears, so just want to pull that pinna up like we did with the cleaning, squeeze, and down in there to make sure it's down in the canal. You don't want to take the tip and just shove the tip down all the way. You just want to kind of hold that above the ear and place that in the ear. And again, just kind of rub that around so it gets everywhere it needs to be. Clean ears. We have Adeline here. We're going to put some Profender on her neck. That is a topical dewormer for cats. So we want to separate the hair here. Really at the base of the skull is going to be the best place to put it, so that she can't reach it to try to lick it off. You part the hair to get so that the application goes down in the skin. You just squeeze the tube out onto the skin like so, and then I usually cover that back up with the hair so that it doesn't show all the grease and everything. Okay. I'm going to perform a gastric intubation on Ivy. So first thing I'm going to do is make sure there is lube on the tube.
I put heparin in my syringe, and I don't believe that it impacts our CBC count.
Kind of set that there so we don't get hair on it.
The last
We'll take our gag and place it in her mouth so that it fits where the canine teeth are, and the canine teeth can fit in those. And then we'll just take the tube and go straight down with it. She's going to swallow a little bit. There we go. And there There we go. We have a gastric tube. So we've got Rosie here, and we're going to do a Schirmer tear test on her once I can get the package opened. Scissors in the pocket. Always good to have handy. So, get this unfolded. And I'm going to take this strip and bend it on. So we'll just take it and put it in that lower eyelid. Bend it down. Hold it there. It feels weird. Can you hold that there? And then we'll take this other one. Do the same thing. And we just want to do this for a minute. This will measure her tear production so that we know whether or not she's got any kind of issue with dry eye or anything along those lines. And when you do this before you do any other eye tests, because the other eye tests such as the tonometry and the fluorescein staining use proparacaine, and that can influence this test because then you're putting extra liquid in the eyes, so your Schirmer tear test at that point would not be accurate. So it has been a minute, and we are just about at 10 millimeters each, which I have to double check, but I believe that is within the normal range. Next thing that we're going to do for Rosie is a tonometry, a glaucoma screening. We're going to check the pressures in her eyes. So the first thing I'm going to do is put some proparacaine in these eyes. It's a numbing agent, so that way when I actually touch the tonometer against her eye, it will not be quite so uncomfortable. I'll just do a couple drops in each eye. This has been in the fridge, so it's probably a little bit cold for her. And then while that's going, I'm going to go ahead and calibrate the tonometer. You can see that we've got our little protective cover on it already. And so just getting this tonometer calibrated. Make sure that it will work properly when I do the tonometry. All right, and the tonometer says good, so we are good to go. The right eye. That one's only giving me 7. And 4. And 34. So that looks to me like that's a little bit of maybe operator error on that case. We'll try again and see what we get. That one is 20, 23, and 18. So those are a little bit more in normal range there. Okay. And finally, we're going to do a fluorescein stain. There are a few different ways to do this. My preferred way is to actually take the stain strip and put it in the syringe, and then fill that syringe with some sterile saline or sterile water. And then just take that, place a drop or two of the stain in the eye. Generally 1 drop is enough. Let that set for a minute. You can wipe the excess off. And then you want to flush all of the excess out of the eye. So that wearing an enema for an adult animal, we have our gravity bucket here, and we will fill that with some warm water. And here we have our veterinary surfactant, which assists with stool softening and lubrication and laxative properties as well. So we will throw some of that in there. There aren't really precise measurements that we use. Just enough to kind of make it a little bit cloudy. Now there are a couple of different ways that you can do enemas from this point. You can use on smaller animals or cats, you can use these kind of enema tubes and attach a syringe to the end of them. So you would hold the enema solution up in the syringe. You would take your tube and lube up the end of it for the comfort of the animal and easier application of the tube in the rectum. And then once the tube is in the rectum, attach the syringe to the end of it, and then you would just squeeze very gently. You don't want to be squeezing too hard for an animal so that you're not putting too much force into the intestine or the rectum or the colon actually at that point. So just squeeze very gently, and at that point then you usually, for cats, you usually will just take them and put them in a litter box once your enema administration is finished, and let them do what they need to do in there. Sometimes you will get feces and liquid coming out on the table, which is pretty normal as well, and just kind of clean them up and then again put them in the litter box, and hopefully they poop for you. Rosie, who is going to be our demonstration dog for our enema, and this tool is part of our enema bucket, and again you would lube this up really well just like you do the smaller tubes, and then you would take it and actually place it in the rectum. You don't want to go very far with it because obviously you don't want to perforate anything or injure anything in the body. So generally about to the ilia is where you would like to go. The crest of the ilia here is probably about as far as you would like to go with that. The benefit for this tool versus just the tubes is we've got a little bit of a hook on it, so we can actually pull some of the feces out when critters are constipated. We can get those big fecal balls and things like that out. And then once that is in, we've got our bucket with our gravity system, so we just hold that up and the water comes out as needed, and then again we can put that back down so we can control the flow of the enema a little bit better as the administrator of the enema moves the tool in and out of the rectum. Rosie here is going to get some subcutaneous fluids. We have our fluid kit already set up here, as you can see. We've got our hanger from the ceiling so that we can reach the bag. We use an 18 gauge needle because that makes the fluids go a little bit faster. On smaller animals we might use a 20 gauge needle, but Rosie is big enough that we just want to have those go as quickly as possible. We're going to tint the skin here right about the shoulder blades and insert the needle under the skin. Oh, that pinches, doesn't it? We've got our fluid line closed off here, so we'll roll that up. And you kind of need to squish it a little bit so that it's not still pinched off. You can see right now that the fluids are not flowing, so I'll just readjust the needle a little bit, pull it out, and the fluids are flowing now. Generally, on smaller animals, we give around 100 to 150 mils of fluids. Larger animals will get a little bit more, and of course it always depends on their hydration level, what they need. There we go. When you're finished with the administration and you have the amount that you need, you simply clamp off the line again. You want to do that before you take the needle out of the skin so that you don't have fluids everywhere. Hold your finger over the spot where the needle is and take that back out. And we always change the needle once we are finished so that there's a brand new needle on each time. Our white tape here that we'll use as part of an anchor. So put that right there on her leg here. here. Kind of big tape for a little bitty leg. And then to keep that from doing what it's currently doing and getting messy and sticking to itself, we will do our little...
I know. Very sad.
Punch depressor there. We've got our padding that we're going to use. And we'll just roll that up. It's just the foot that we're paying attention to on this bandage, so I'm just going to roll it up a little bit proximal to the corpus.
Microbes in it that will burst, so that should be really easy. Yeah, he does that.
Get that padded real good.
Either way, it works. Either way. You just get stupid. Right.
And we have our gauze that we'll place over that to help kind of squish that padding down a little bit.
I found that out yesterday, really fast, that she's sitting there.
She's got my humor, so if she's got that part, then we're good.
Yeah.
And
otherwise, I'm going to make you cry or offend you, one of the two.
She's already threatened to mess up my cabinets out there.
so we've got that. And then this is where we'll take our stirrups and we will twist this around to help support that, to make sure that the cast doesn't slip, or not the cast, the bandage doesn't slip down Ivy's foot on both sides there. And then we have our vet wrap that will cover it. Loosen that up a little bit so we don't make it too tight. We don't want to put too much pressure on this leg and end up make sure these toes are out here.
I appreciate you what I did.
There we go. Don't want to put too much pressure on this and end up having a foot that there we go. And finally, we'll do a little bit of elasticon down here at the bottom to help protect this foot and this bandage while she walks outside. So, Ivy here has a little bandage on her paw. She's got an injured paw pad and nail. We're going to take this off before we treat it. So we've got our bandage scissors here with the blunt end that we just take and slip underneath the bandage and just cut along the way. And then we can just pull that right off. So today we're going to place a splint on Rosie's rear leg. So if Rosie will cooperate, we will lay her on her side. I know, baby girl, it's terrible. And just by measuring the splint, you can see that it is, it fits right here around her hock, just right about down to the toes, and fits right up here by her knee, and is the appropriate width as well. So that is a good size. So we'll start with our modified Robert Jones and place our tape on either side of her foot. So we will start with our cotton here and wrap around the foot. Start with this distal end, keep a couple of toes out, and wrap at least 50% over the previous layer. And just continue up proximal and around this knee. I want to make sure that we get enough up, high enough on the leg so that the whole thing is covered and that splint is supported. And we'll do our elastic gauze. Cover. Just to help kind of conform that a little bit. This is where I will take my tape and twist it. So this is where generally we just cover with the outer layer when we're doing the modified Robert Jones. But we're going to go ahead and place that splint. There we go. Now our splint is spot where everything is cushioned, so whereas you should not be uncomfortable once this split is placed and secured. And this then is where we do our outer wrap. Generally, I would use a 2-inch wrap versus the 4-inch wrap that I have here, but this stuff is free. So just for this demonstration purpose, we're going to use kind of the giant. But you just want to take this and wrap this around the splint to help protect that. We'll do some elasticon here at the bottom of the bandage splint, so that when she walks on it, there's a little bit of something with a little bit of traction there. So that is the splint. All right, so now that we've got the splint applied to Rosie, I'm going to demonstrate how we would remove it. We've got this elasticon on the bottom. Generally, the splint is going to be on for more than about 30 seconds. So you would start by just getting the bandage scissors and very gently inserting it underneath that outer wrap and cutting through it. And then there are a couple ways you can do. You would be able to cut through this, or you could just unwrap it like I'm doing. Uncover that splint. And then at this point, since you've got those stirrups there, it's probably the easiest again to just kind of cut through this elastic cotton here. And then from there you can just gently unroll everything that is on the leg. Remove that tape as well. And no more split. Demonstrate a quick boo-boo bandage on Ivy. This was one that I actually did at home the other day for her after she got bit by one of my other dogs. And so I just had the non-stick here, and then I just took my bandage and placed it over the foot and came around to cover that really well, and then I came up the leg with it so that I could help make sure it was secure. And then I just took some white tape and applied that to the top, again to help make sure that's secure, make sure it didn't fall off between home and the clinic. And that was her quick boo-boo bandage. So for an emergency treatment, if she were to come in, we're going to sort of simulate what I would do, for example, if she had a dehiscence from a spay recently. So the first thing I would do would obviously be to assess fermentation. Right now I'd say she's quiet, alert, and responsive. We would take a temperature and then of course listen to her heart rate. So I'll go ahead and do that. I'm not hearing any murmurs or anything. Her heart rate is about 70, so she is very calm and maybe sedate. I would check her capillary refill time. She is pigmented, so it's a little bit hard to tell, but her tongue is nice and pink. We've got a little bit better pigment here on this side, and it turns back to color pretty quick. I'm not seeing any issues as far as discoloration of those gums or the tongue. Check her eyes, and those look like they're doing well. Also would check her respirations. She's breathing fairly easily and not having any respiratory distress or respiratory difficulty. So at this point, I would go ahead and place a quick wrap on her belly for the spay dehiscence before the doctor came in to look at her, just in case, you know, it would be a while. So let's go ahead and get her stood up. And of course, if there were ever a spay dehiscence, Tara would be holding her back here.
Well, yeah.
So we've just got a large sort of Telfa type pad here that we're going to use, and some vet wrap. We would also assess her pain at this point. Obviously, since she doesn't actually have a spay dehiscence, she's pretty chill. We may actually, so this would be a fairly gentle, we would just do this as gently as we could to cover this area up. And just a very easy wrap. We just want to make sure that anything that is coming out of that incision is going to stay where it is and not come out any further. So this is probably a pretty good wrap for her, and we can just stick that there, and may stick a little elasticon around just to make sure that everything stays again where it should and we don't have our bandage slipping. There we go. Okay, we are here with Annabelle this morning. She is getting a dental cleaning. Her x-rays, radiographs have all been finished, and I'm going to start now with the debulking process. As you can see, I've got a smock, gloves, cap, mask, goggles, partly, well, mostly really to protect myself from any bacteria that will be flying around once I start really cleaning those. So we've got our tools here for debulking the tartar, and we just take these and squeeze gently and get those big chunks of tartar off.
Room 1 for Dr. Hufnagel's 8 a.m.
I'm going to check all the teeth to make sure that we've gotten as much as we can before we start polishing. Now that we've got the tartar debulked from Annabelle's teeth, we're going to start with the ultrasonic scaling. And you just take the the scaler, hold it right up against the tooth, push the button down all the way. I'm going to make sure that that water is flowing so that we don't overheat anything. And continuously move around the tooth so that you get all the surfaces, but you're not in one spot to make it too hot. One thing that you don't want to do when you're doing the ultrasonic scaling is actually take the tip and polish with it at a 90-degree angle to the tooth, because that can ruin the enamel. So we're just going to get these teeth all polished up, or I'm sorry, all scaled, and then we'll do our probing and our polishing. Okay, so now that we're done with the ultrasonic scaling, we're going to go ahead and probe Annabelle's teeth. We can see a probe here, and it's got some little notches on it. The one closest to the tip, that's a 3mm notch, and then a 5mm notch, and this one is about 10mm notch. So that can give us an idea of any gingival pockets or perio pockets that we might have in the mouth. So you just probe real gently around the teeth. You can see here we've got a little bit of gum kind of poking out, but it's only about 3mm. You want to make sure to check both the lingual surface and the buccal surface of the teeth, so that, or on the top rather, the palatal surface and the buccal surface of the teeth, so that we can verify that we don't have anything. And you just go along and do that with all the teeth. And now that we've got everything probed on Annabelle, everything looks pretty good. We're going to go ahead and polish. we've got a big jug of polish, so everybody gets their little individual stick, and we've got our tip on here for the Pro-Feed. We'll just go ahead and get a little bit in here. Ooh, that's a bit much. Like so. Put it up against the tooth. And this one needs to go a little bit slower. This is just kind of slow and steady along each tooth. Again, you want to make sure to get all surfaces of the tooth. And you can just stay for a few seconds on each tooth just to get that polish on there nice and good. And finally, now that we've got Annabelle's teeth scaled and probed and polished, we're going to go ahead and do a bit of a rinse. We've got a water button and an air button. Press down a little bit on the water button, add a little bit of that air button, and get all that polish and any bits of tartar that might be still in the mouth out so she can feel fresh and clean when she wakes up. In regards to our home care products, we have several varieties. We've got some dental oral care chews, small, medium, and large. We have some toothpaste, and generally when we speak to clients about brushing their teeth, we recommend that they do it at least every other day. And we go through the training process of putting a little bit of toothpaste on their finger, getting the patient to like that, then kind of starting to use their finger as a brush. Getting the patient used to that, and then finally actually using the toothbrush. For kitties, we've got some Feline Greenies, some Feline Greenies dental treats. We do also have the water additive that can be put into water bowls or water fountains for pets. And then of course our dental toothbrush kit. There. And then of course we've got some more but oral care chews. And then finally we've got some TD dental care that we can send home as well.